You're listening to the heartbeat of the University of Maryland, Baltimore, the UMB Pulse.
Welcome to our April 2022 episode of the UMB Pulse. I am Charles Shalee.
I'm Dana Rampola.
And I'm Jenna Frick. On this episode, you're going to learn how one University of Maryland School of Pharmacy program is being a changemaker both in West Baltimore and nationally through advancing health equity in communities.
Yes, the Patients program works with care providers and, of course, patients on the best treatment options to improve their health and quality of life. They do this through a combination of listening to patients about the care they're receiving and bridging what's happening in the research laboratories to disseminate to community members. This program was launched in 2013 with a 5-year, $5 million infrastructure building grant from the Agency for Healthcare Research and Quality, which is part of the U.S. Department of Health and Human Services.
Yes, and not only are they going to senior centers and congregations to talk with West Baltimore residents, but they're also leaders in their field, speaking in front of the Food and Drug Administration, Centers for Medicare and Medicaid Services, the National Academy of Medicine, and numerous universities and patient advocacy organizations.
And so joining us here on The Pulse are School of Pharmacy professor and Patients Executive Director Daniel Mullins and Engagement Specialist Rodney Elliott. So thank you both for coming on The Pulse today.
Thank you for having us.
Thank you for having us. Glad to be here.
Yeah, so I guess the old adage is kind of that people say, oh, my doctor doesn't really listen to me, my pharmacist doesn't understand what I'm trying to say, or I don't know what's happening to my information once I give it. And the Patients program is challenging that notion. Can you kind of give us a snapshot of what the Patients program does to help both patients and researchers?
Yeah, that's a good way to put it. I mean, basically, we're the bridge. We're the bridge between the community members and the researchers, and we try to give the community members that information that they need to be confident when they're in those doctors' meetings or when they're talking to their pharmacists. And, you know, when the researchers come to us, we want them to make sure that when they do decide to partner with us, that it's not like a one-stop shop. You know, you got to come in, let us know what you want to do, what your plans are, and how we can help you from beginning to end. So that's kind of a nutshell of what some of the Patients program does.
Got it. That sounds really important, opening up that line of dialogue and communication. So why is the Patients program important to both of you personally?
Well, to me, I mean, I have a background. I'm born and raised here in Baltimore. My background is in sports, but I've been with the Patients program for about 3.5, 4 years now. And I've always had a passion for helping people, helping the community. Dr. Mullins and I met through a friend of a friend, and I heard a little bit about the project, Patients program, and then more and more I learned about it. I knew this was a good opportunity for me to, again, extend that. You know, post my basketball career was having an opportunity to stay connected to the community in a real, genuine way. And my 4 years I've been here, we've been able to do that.
As a researcher, you're always aware of the fact that there are real people behind the data points. But the first part of my academic career, you know, I really sat behind a computer and I analyzed data. And there was a lot of interesting information that came out of that. But what I realized is that we were then trying to see how that could influence patients. And I began to realize that instead of analyzing data and then presenting what we found, we really should be talking with patients up front and having them help us think through, how do we really ask important questions? And then, yes, it's important to collect data and analyze data. But if we're not asking the right questions, then the results of the analysis really aren't going to have the impact that they could.
Can you give us like an example of like how that works?
A lot of researchers will come to us and they'll say, we're having trouble getting people to come into our study. And can you help us find patients for this study? What we try to get them to realize is what you should have done is you should have come to us 2 years ago when you were designing your study, because you're asking us to try to get people to participate in something that's not important to them. If we had changed your research so that it was meaningful to patients, you wouldn't be in this situation today. So how we're trying to change this is getting researchers to talk to us early, bring patients in, not just as participants in a study, but really as co-designers, framing the question so that it's important in the minds of patients, and then designing the study so that it's convenient for a patient to participate, so that they understand what the research question is and what the research is going to answer. And that way we think that people will participate. They'll also be able to understand what we're learning because the question makes sense to them. So a solution that can help them to improve their health, their diabetes, their HIV, their cancer diagnosis, and survivorship journey, they'll be able to really understand how to take what we're learning and incorporate that into their lives if they're part of designing research.
So
Great.
getting their buy-in early because they'll feel like they have an ownership in the outcome.
And not just buy-in, but what you need to understand about what this research is doing so that they see the importance of it first, because that's when the buy-in happens. Exactly.
Gotcha. Well, let's shift gears a little bit. How did the pandemic become a disruptor to the patients program, and how did you pivot?
Oh man, multiple ways. One of my roles as the engagement specialist is to literally engage, go out into the community. So back when the pandemic hit in March 2020, we first got word we were literally getting ready to participate in a community event, Be More Healthy Expo. But we got the word that, something's not right. We need to fall back off that event. So post March 20, I couldn't be out in the community. Our team couldn't be out at health fairs, engaged in the community. That was challenging, but as far as projects concerned, we do a lot of focus groups, things of that nature, and we do those in the community. We do those in the basements of churches. We do those in senior citizen buildings, things of that nature, but we couldn't do that anymore. But we found a way to pivot, and we were able to be somewhat successful with focus groups virtually. So that was something that was very helpful as well. So, we still found a way to stay connected. It took us a while to get there, but it's something that we're doing now. And excuse me, even post-pandemic, I'm pretty sure we'll probably still consider that.
Well, that's good.
The early days of the pandemic, the challenge that we were facing is we knew that we needed to stay in touch with the community. Right. When research started opening up again, we knew that we wanted to continue to do research. So doing focus groups using things like a Zoom platform. But the community of West Baltimore had pockets where people, one, might not have access to the internet, but even if they did, they weren't using Zoom. So how did you get onto, Facebook or a phone and teach people how to use another platform? Because remember, in the early days, a lot of the platforms weren't HIPAA compliant, so we couldn't do research using some of the platforms. And we need to be very aware to not just connect with the community, but to do it in a way that was following policies and regulations.
So now your community-based work and partnership is building to something much bigger. Tell us about the new initiative between Patient, Mount Lebanon Church, and CVS Health.
This is incredibly exciting. You can imagine as a researcher that we think we have all these important questions, but a lot of our questions in the Patients program actually come from our community partners, and in particular the leaders whom we work with. The senior pastor of Mount Lebanon Baptist Church, Pastor Frank Lance, he's been wanting to expand their community outreach. He's been working with CVS Health as the School of Pharmacy has been working with CVS Health. They convinced CVS Health to use CVS dollars to refurbish a significant portion of the basement of their church to be a jobs training program for pharmacy technicians.
That's amazing.
Very much aligned with the School of Pharmacy, right?
Right.
And so what we thought was that this is a great opportunity to bring together what the community says they want, which is jobs training, with an opportunity to talk about health and health-related research. The initiative that we're doing is looking at how, if this partnership of CVS Health in the basement of Mount Lebanon Baptist Church, working with the Patients program at University of Maryland, Baltimore, if that partnership had been in place when the COVID-19 pandemic started, we would have been prepared to work with the community at the beginning of the pandemic. And so our current initiative, funded by the National Institute of Minority Health and Health Disparities at the NIH, is looking at how do you develop that kind of authentic community academic partnership so that the next time a pandemic hits, we'll be prepared to deal with it in an even better way.
Wow.
That's incredible.
It really is incredible.
Oh my gosh.
So how do you think then, I guess, post-pandemic, this could be utilized?
Well, we're really excited. We believe that CVS is such a large company that when we demonstrate, because in my mind there's no doubt we'll demonstrate the success of this model, you could scale that to every rural part of America, every other city in America. And there's a lot of community-based pharmacy that could be partnering with lots of community institutions, not just churches, but other institutions. And we can bring the idea of health and what the community wants. In West Baltimore, it's jobs, and other communities may be something else. But bringing together what the community wants and our ability to educate and provide health care in those communities together so that the community sees us as a partner. Then when we're trying to do research to improve health, people are going to want to partner with us because they've seen us help their communities.
Right. The relationships there established, trusted.
Exactly.
And this speaks obviously to Dr. Gerald's initiatives for the university, his commitments to not just the city and the people just adjacent to the university, but Maryland as a whole. So really exciting stuff. What difference do you think Patience is making in the communities with these programs, like on a day-to-day tangible level?
Day-to-day tangible level, I think when I first started going out into the community a couple of years ago, I would go out and, I have a button-up shirt and I got my, jeans and slacks on and my clipboard in my hand, and I would get a little bit of attention. But then when I realized that I'm talking about a project or talking about the patients program, and I mentioned the R word, which is research, I can immediately see people kind of tense up a little bit. But when I started going out into the community and meeting the community where they are, at a local health fair, at a recreation center, where, for example, a senior home center, where I did a project that was in between food giveaway and in between bingo. And the senior care coordinator said, you need to come in here this hour, but you better wrap up right before bingo because the seniors don't play about their bingo. But it was because I came out there to have my shirt on, and I'm talking to them and asking them how they are, and introducing the project and the program. And we don't force our information on anyone, but we just make it readily available. So just being out there, out in the community. I'm one of 3 at the engagement team, 4 in an engagement team, and we find ourselves out in the community all the time, and we're excited about getting back out into the community, not only just for projects, but again, just for educating them on the importance of, having a seat at the table when it comes to research.
Right. One of the places that you do this community outreach is in barbershops, right?
Yeah.
Yeah, I remember you all talking about that. It was, oh my God, years ago at like some Empower event where you were presenting about like your different research, and it was particularly the barbershop program. And I was like, wow, that's really cool. And what a great way to reach like a very specific demographic that maybe is not into research and being a part of that. So that's really cool.
It's just that, literally going to the barbershop. I mean, when you go to the barbershop, that's where you talk about everything. Sports, you talk about what's going on, current events, things of nature. So why not talk about health? Those topics do come up. And I forget where I was after that project in the barbershop. I was somewhere, someone recognized me, and they said, hey, are you Rodney Elliott from Patients Program? I said, yes, I am. And they said, because you stopped at the barbershop, I went home and I spoke to my husband. I told him to make sure he get a health checkup. And he wound up finding a small lump. It was rare because it was breast cancer, I think, for a male or something like that.
Mm-hmm.
And it was really profound because she overheard the conversation in the barbershop and heard us talking about how important it is for men, African-American men particularly, to go get checked out. And, things worked out for me in that situation. And it's little tidbits like that kind of let me know that the work that I'm doing out in the community, impacts our community, beyond the projects. Sometimes it's just something just as simple as just having a conversation. And that's what it's all about, having that conversation.
Exactly.
Yeah, definitely.
I also think, too, that, we talk a lot about bringing the voices of patients into a university setting or into our research. And for a lot of people, they might have been asked questions in the context of research before, but there wasn't the sense that their opinion really mattered. I think the difference between kind of a traditional research program and ours is that we have some patients who are actually advisors or co-developers of the research. And those individuals are really helping us to think through how to phrase things, how to implement our research. Our recent project on COVID-19 with the FDA was helping them to understand how they could enhance their communications early on during the pandemic when it was about testing. Remember back when you couldn't find testing,
Right.
Nothing was available at that point. And then how do we talk about testing as testing comes out? For people to understand that what they were saying could help a federal agency to enhance their communication so that people would have better information and be able to understand it. That's a really empowering experience for an individual to think that their voice can have that kind of an impact. And as we were completing that project, we saw a new form of testing come out. So you see what we learned in those early focus groups that we did with community members comes up again, because now we're going to be in a similar situation, right? What is the difference between a home test and a test that I get at, for instance, a clinic? And how do I know which test to believe if 2 different tests say the opposite? One says I'm negative, one says I'm positive. How do we make sure that agencies like the Food and Drug Administration have what they need so that they can communicate with the general public in a way that helps people to make really informed decisions? And that's what healthcare research should be about.
Right.
It's just kind of amazing, like all the stuff that we've been working on to kind of communicate with the campus population with some of this, and it's like, oh, we're actually doing that here on the front lines with the
Right.
patients programs of telling people this is what you need to tell people to understand the differences between these tests.
I mean, but I think one of the things, so Dewan Patterson is one of the community partners who's an advisor on that project. And he talks a lot about that he was willing to help us do this project. And that the point of that project was supposed to be to make sure that when we phrased our questions, that the community would understand that there was nothing racially insensitive, that people would feel comfortable sharing their views. But, then you go home at night and you talk with your family. And he talks about how his grandmother, who was very hesitant about, a lot of things related to COVID, eventually became almost an advocate for getting people into testing, for getting people into, treatment if they get a diagnosis. And that had, nothing per se to do with our study. But when you're involved in a study and you have conversations, suddenly you go home and what you're doing impacts what your family's thinking about, right? And so when
Right.
you're trying to change people's perceptions about research and health-related decision making, sometimes it's just that. It's that because of an experience in a research study, people are thinking more about how to be healthy and how to make healthy choices.
Right.
Yeah, that popped up in another project I worked on, Dr. Mullins, in a focus group where we had 2 first-time virtual focus group seniors at a senior home here in West Baltimore. And prior to the focus group, I talked to them over the phone and helped them navigate how to get on Zoom, which was a challenge, but it worked
They
out.
did it.
And then they found out they literally lived in the same building. They didn't know that originally.
That's funny.
So after the focus group, I called back just for another opportunity, and they mentioned that they started during the pandemic, they started a virtual kind of just talk session on social media, on Zoom with other residents in the building, because back then, when we were told to stay home and isolate, a lot of things people don't realize, like when you isolate, that also goes to social isolation.
Right.
And a lot of the older adults, seniors, kind of dealt with that and not being able to go out for their normal walk. They weren't inviting their family members up, things of nature. So that helped them out a lot to still be able to communicate with each other in the same building, virtually in a safe space.
Shifting gears now to a national level, you do a lot of work to build health equity in all sorts of spaces. So what's the dynamic then of doing this on a national level and building trust in pockets of like rural America?
And the interesting thing is when you talk to groups that typically don't participate in research, it's all about trust, right? And so the populations may be different, kind of the specific issue may be different, but eventually you're going to get to the word trust. And what we believe is that we're learning how you can build trust, but that means being very respectful as you enter a community to make sure that the community leaders know that you're entering their community, right? I think it's a mistake that researchers make. Sometimes they just literally walk into a community thinking that community is going to want to participate. They don't keep people informed. And so we don't have good relationships sometimes then with the community leaders, because those are the people that get asked questions, right? We know this from healthcare. If you go into a community clinic and you have a physician refer one of their patients into a study, and that physician doesn't know what the study is about, when the patient goes back to their primary care provider, the primary care provider is not going to be excited about recommending a patient to research in the future if we don't keep that community provider informed. Well, the same thing is true with the pastor of the church or any other community leader. If they don't know what we're doing, they're going to get questions that they can't answer, and they're going to be less likely to refer people into a study at University of Maryland, Baltimore.
Right.
In contrast, if they do know what we're doing and they see how it could make their community healthier, then they're going to help us to convince people that you might want to talk with this group because they're doing something that maybe won't have a direct benefit to you today, but can help our community to be healthier in the future.
And it goes back to that concept that you describe on your website of you don't want to continue that helicopter experience, right?
Yeah.
Of researchers coming in, and we're communications folks. We hear a lot about national media doing the same thing with national news stories of the helicopter in, get the story, and come out. And so it was interesting to learn how research for a time being was being done the same way.
And still is in a lot of places, right,
Yeah,
Rodney?
still is. And that was the concept I mentioned to you earlier about me, lab coat, clipboard, going into the communities, saying the R word. Yeah, that's not, the communities that we serve, that's a faster way to get a rejection more than not even rejection, but just, I would say, a closed ear and a closed heart. When you find a way to get into these communities and My biggest thing is I just want to, present them with opportunities and give them information so they can make an educated decision and a choice, right? So that's the major thing. So when we see helicopters here in Baltimore fly around in downtown area, we kind of know what's going on. They surveying, seeing what's going on, seeing what they can get. In research, that doesn't work. You can't swoop in and get what you need and get back out of there. That's what Dr. Mullins was talking about. Patients program was started. Come to us in the beginning so we can help form it, so we can help shape it, and that goes, again, from the beginning all the way to the end.
So back here at home, you have a new $250,000 award for the Patient-Centered Outcomes Research Institute to work with the Southwest Partnership. What does that grant work involve?
This is a contract with PCORI, the Patient-Centered Outcomes Research Institute, to build the capacity to do research in the future. So it's not a research study in itself. It's called an engagement award. And the idea is for the University of Maryland, Baltimore's patients programs staff to work with the Southwest Partnership and over a 2-year period to figure out how could these two groups work together on future research. I give a lot of credit to PCORI for giving this type of funding to really build an infrastructure to do research in the future. And I think that's why we've been successful. We don't start by knocking on someone's doors and asking them to start today on a research study. We go and we knock on their door to say, in the future, we're going to want to work on a research project with you. Let's talk about what would you be interested in working with us on? How do you want us to approach you? And then how do you want us to approach the community that you represent? Right? It's building those relationships. And this new award is called CoDRIVEN. It's because the future agenda will be co-driven by the Southwest Partnership and the University of Maryland, Baltimore.
Mm-hmm. Wise. So I was reading up on it on your website, and it mentions there's going to be a stakeholder advisory board. Is that right? And that there are flashcards involved. So tell me about this flashcard method.
Right. So first, yes, there's an advisory board, and the advisory board members are chosen by the Southwest Partnership. That's another thing that we do is we ask our community partners to decide who do you think we should be inviting to our sessions. The flashcards come from a prior PCORI board that developed this idea of when you ask people, how do you think we should engage your community, they may not understand the question. And so we've come up with flashcards, and they have different ways of engaging people. We all know that we get surveys, right? So, whether to ask people to fill out a survey, that's one way that you can engage people. Another is to hold a town hall meeting. Another is to actually do an individual interview or a focus group. And there are a bunch of these different methods. Another is social media, right? And so the idea is giving them flashcards so that even people with low literacy levels can look at the picture and know what this is, and then say, pick up the flashcard that for this study you think is the best way to engage patients and tell us why. So we're having them not just tell us how to do research, but how to engage people who are going to then be involved in the research. And we think that type of interactive play with our community partners will make it more enjoyable for them to help us design our research studies together.
Yeah, that's very inventive, and I can't wait to see how that shakes out here. All this is about building trust, as you mentioned. That's the common theme here, and you really want a two-way street of communicating, but you also need advocates. So you have this Patients Professors Academy being developed for both patients and researchers. Tell us a little bit about that.
The Patients Professors Academy really is in response to the fact that we have so many government agencies, so many universities, so many other groups asking us to come and share how we're doing what we're doing. And it got to the point where we couldn't keep up with those requests. So we thought, instead of our flying around the country doing individual training programs for people, why don't we invite a large group of individuals to come to the University of Maryland, Baltimore, and participate in a session in which over a 6-week period, they will learn how to do something. Of course, we've now all learned how to do training using virtual platforms. So most of the 6 weeks, people will be learning using platforms like Zoom. But the idea is to go through our 10-step framework for continuous patient and stakeholder engagement and really teach people things like, how do you build that type of partnership that we have with Mount Lebanon Baptist Church and CVS Health? How do you form an advisory board of community members and other stakeholders for a research project? How do you make sure that you're addressing health equity when you're designing your study? And then we teach them, like, how do you make sure that your recruitment is something that people will buy into, right? And so we go through over the 6 weeks from health equity at the beginning as the target to then how do we make that happen in very pragmatic ways? And a lot of it's interactive. The idea of the academy is that we have these amazing patients who have taught us so much about how to do research. And so those who have been on this journey with us for 5 or 10 years, we call them patients professors because they teach us how to do research with their communities. And so one of these patients professors and one of our researchers will co-present how we've been doing things and then give about 175 people an opportunity to practice how they would do that when they go back home to whatever part of the country they live in.
Wow.
And this has some weight behind it because you have Bayer, AstraZeneca, Novartis, and some private donations. How big is this, and when will this start?
It will start in July. We currently have 7 major donors. Our target is $1 million for this, and we are about 3/4 of the way to our funding. We still have a couple others that have given us verbal commitments, so we're very confident that we'll have that. Yes, our sponsors include pharmaceutical companies like Novartis, Bayer, Lilly, Janssen, J&J,
Wow.
Pharma. But it also will include, we believe, other groups like from the insurance industry or from the banking industry. So any of the groups that understand about holistic health, and that's not just physical health and mental health, but spiritual health, working with the religious groups that we work with, and then also financial health. Because if people don't have the finances to afford what they need to be healthy, they're not going to be healthy. And bringing all of those 4 pillars of health, physical health, financial health, spiritual health, and mental health together in one training academy and teaching people how to partner, we believe that that will then take what we're doing here in Baltimore and allow it to spread across the nation.
And how many students do you think you'll have in this first cohort?
We expect to have 150 to 175.
Oh, wow.
We're reserving 50 for actual patients or care providers, right? So perhaps the child or the spouse of someone with a condition. And those will be from around the world. We also have people from the life sciences industry, so pharmaceutical companies, device companies, those who pay for care, so insurance companies, but also large corporations that self-insure, government agencies, and not just the federal agencies, like the Food and Drug Administration or the National Institute of Health, but local agencies, right? So thinking about local government agencies, not just here in Baltimore, but in some rural area of our country where they're setting policies that affect people's health.
Mm-hmm.
And then a variety of community healthcare providers, but also other community leaders who we know influence health. And what's really unique about the Patients Professors Academy is that all of those types of, quote, students will be learning together, right? So we're not going to have a breakout room for patients and a separate one for researchers or providers. Everybody comes together because that's how we believe research should be done.
Smart.
Right.
Mm-hmm.
And so is it completely underwritten then by these different entities? So there's no fee for the participants?
At least in the inaugural year, there will be no cost for, quote, tuition to come into the academy.
Okay.
It will be free for everybody. And fortunately, our funding for the first year includes travel stipends for anyone who needs it. So we've earmarked that not just for the 50 patients who will be coming, but there could be people from a local government agency that really just don't have a travel budget. We want those individuals to be able to come to Baltimore as well.
Right.
Wow,
Well,
that's
we will
incredible.
Great.
make sure to post a donation link in our episode description.
For sure. Yeah. So this starts in July. Oh, wow. It's coming up very soon.
Right.
That's really exciting. Obviously, you guys do a lot of work engaging all different types of people from all walks of life, all different backgrounds. And Rodney, you specifically do some Real Talk on Facebook Live with your program, Real Talk. Can you tell us a little bit about that and the topics that you cover?
Oh man, that was one of our pandemic pivots. I see you guys here on your pandemic pivot. And lovely joining you guys. But right, we couldn't go out in the community. I couldn't go out, so we found a way to still stay connected with our community, keep them updated on what the patients program is doing, what our project was doing, the community members we was working with, the project we was working on. And it's also a way to stay engaged live. So we have a couple bullet point questions we want to talk about during the conversation, but we also engage with the community members who watch us. So our viewership actually grown since pandemic started. I think when we started, it doubled. So we started in March 20, and we had 243 members on our social media platform. As of March 2nd, we got 4 31.
Wow.
So that was an opportunity for us to share the word, share what we're going on, and also talk about the patients, the PPA. You know, talk about CoDRIVEN projects, right? And we've had everyone from Pastor Lance has been on our show before. We've had the President Bruce Gerald was on our show as well. And you know, again, we've had community members who participate in some of our focus groups, right? Because we want to find a way to still stay connected with everyone. And social media is a platform that we're all using right now. It was new to the patients program, but it's been an awesome tool for us to spread the word.
Yeah. So it's called Real Talk. You do it on Facebook Live. When does it air? When can people tune in?
Well, it's actually Real Talk with Rodney, and we also have BJ's Corner. BJ Shaneman has been working with the patients program. She's another engagement specialist. She has over 40 plus years of experience. So it's every other Thursday at 12 o'clock noon, right on our Facebook Live page.
Awesome. And do you have a little tease of anything you have lined up coming up in the spring that people can look forward to on that?
Yes, we'll have a bunch of topics about the projects we're working on. We're also going to be talking about the Patients Professors Academy. So we'll have some of our guests on there talking about their participation, but also some of the actual patient professors that we have currently with the patients program. So it's an exciting platform for us. I'm always excited about the engagement because you just never know what you're going to get from some of the questions that we have. But again, it's a way to stay connected in a safe way as well, because, you know, as things are starting to open up and getting back to what the new norm is, folks still like to still stay safe in their home or safe in their devices. So staying connected to the community during our Facebook Live session with Real Talk with Rodney and BJ's Corner is something the patients program is proud of.
Awesome. So everyone definitely tune in. You said every other Thursday.
Every other Thursday
All right.
at 12 o'clock.
All right.
Sounds great. 2 years ago, you all had your first community research jam. Can you tell us a little bit about what that is and if you're maybe planning another one in the future?
The patients program is quite involved in the Institute for Clinical and Translational Research, in particular in the Community and Collaboration Core. That's the core that supports community engaged research. 2 years ago, we held a session in which we thought about doing something like a dolphin tank, of having a session where researchers could somewhat present to community members and get some feedback, where the prize would be like improved research as opposed to, you know, some of the shows that do this where there's a financial prize. We thought more and more about that, and we brought our community leaders back and asked them how to do this differently. They came up with the revised version of it, which is a community think tank on research. A community think tank on research. The idea here is that they, the community leaders, are the think tank members. They're the ones that really understand how you could do research in their communities. And so you, as a researcher, can apply for a spot to come and to present to the community think tank on the research that you're doing. And in the first 6 months of this, which is under an NHLBI award that's between 5 universities, so Johns Hopkins is the lead, Morgan State here in Baltimore, along with University of Maryland, Baltimore, and then down in DC, we've got Howard University and George Washington University. Our part of this is introducing the community think tank on research, in which the members of the think tank came up with what they call the rules of engagement. If, as a researcher, you want to come and meet with us, here's how you will have to come into our think tank. The next thing they did is they came up with a slide set template, and they tell you can only present these 6 slides. You fill in the slides, but we don't want 25 or 30 slides the way you researchers normally come and talk with us. These 6 slides give us everything that we know so that we could give you advice. And then when it's over, the researcher doesn't get to ask the community members questions. The think tank asks the researchers questions so that then they can give you advice on how to change your research to make it more patient-centered and community-centered. I think it's a really cool concept.
It sounds awesome.
Yeah.
Because you hear so many times of communities, especially more so with like businesses, like, I wish they would ask permission to come into the community and everything. And so you hear the same with research. So now they have a bit of ownership and control over it. So when is this starting, or how far along is this?
We are finishing our first year, and we're keeping our fingers crossed. We expect that NHLBI will fund us for a second year. Again, our contribution is the community think tank on research. There's a lot of other programs. So Morgan is doing an ambassador training program for community ambassadors. The other 3 universities are doing other things. We fully expect that this will continue. And the exciting thing about the community think tank on research is in the second year, we're going to be using our funding to open it up so that researchers from Morgan or Johns Hopkins or George Washington or Howard can come into the University of Maryland Baltimore's community think tank so that those researchers can benefit from this structure that our community leaders have developed.
Great to hear. We talk so much about COVID research, but you do a lot of other things too. Can you give us a little bit of a tease about some other areas of research that you're helping with that's not COVID?
One of the things that we heard really early on during the pandemic was that although COVID is a devastating condition, that the impact on health disparities is similar to in other diseases. And many of our community members said that devastating as this is, that COVID-19 is not the only condition that is creating disparities in health status across America, right? And so what we're learning with COVID-19 research hopefully will not only help us to think about health equity for COVID, but how do we really advance health equity across the major killers? Because if COVID goes away, people are still going to be dying of heart disease. They're still going to be dying of cancer.
Right.
They're still going to be dying of complications of diabetes. And we have such great disparities in those conditions. We need to really understand how to advance health equity, not to do it just disease by disease, but how do we advance the concept of using research to improve the health of the nation across all the different communities that are represented in America.
I mean, we got other projects working on with the NIA, National Institute of Aging, where we're looking at older adults who could be interested in participating in future research projects, where we're signing them up in a research registry. So other entities such as the Patients Program can reach out to them. Other trusted entities can reach out to them and have them give them an opportunity to participate. Another opportunity for older adults who may have some memory challenges. We have opportunities for them to come and share their experiences. Our projects vary, but all of them still have the same concept as far as meeting the community where they are. Again, we're doing a lot of stuff virtually right now. Hopefully, I'll be excited to get back out into those communities where we can do it in person.
So you have a thing called Patients Day coming up. Tell us what that's all about, what it is.
Yes, August 16th, right here at the Community Engagement Center from 10 to 2. It's going to be a free event where we bring the community members and the research community together. A day where we talk about the projects that we have going on. We also provide a health fair for the community members to have some tangible resources. And it's a free event. It's an opportunity for the community members to talk to us, have an opportunity to learn as much as possible as they want.
So that will be here in the UMB Community Engagement Center.
Yes, that will be here.
16 South Poppleton Street.
Yes, it will.
Well, before we let you go, we really should mention some congratulations to you guys for winning the Reverend Dr. Martin Luther King Jr. Diversity Recognition Award this year here at UMB.
Yeah, that was awesome. That was awesome recognition. I mean, Dr. Mullins kind of kept that on he kept it on the low for us. It was quiet. We didn't know about it. But again, that just shows that our work out in the community is, being represented by the community we serve. We say that a lot about bridging the gap and the community we serve, but to be recognized for an award like that speaks a lot to the staff here at the Patients Program, Dr. Mullins, and all his efforts from the very beginning. He's been very, engaged with the community. There's a lot of stories about Dr. Mullins I heard before I got here about him literally being out in the community helping with the health fair. You don't hear that a lot about when you have, CEOs or folks who are, leaders in their projects, but he's always been a hands-on type person, and that's indicative of the Patients Program as a whole.
And that helps build trust, right? You want to put a face to who's doing the work and who's organizing things. So
that's what it's all about, building trust.
Yeah, and it really speaks
sustaining it.
Right, and it speaks to your overall mission of building health equity, which is fantastic. So kudos and congratulations again. And if you want to learn more about the Patients Program and listen to Real Talk with Rodney or BJ's Corner, visit facebook.com/Patients Program. For a link to the program website or to donate, visit our episode description or go to umaryland.edu/pulse. So thank you again to Daniel Mullins and Rodney Elliott, and good luck to you for the rest of the year.
Thanks very much.
Thank you for having us.
Our next changemaker on the Pulse will be School of Medicine Professor Pediatrics Dr. Karen Kotloff. We'll talk about her research and all of her upcoming projects that you may not know about, including work with the Bill and Melinda Gates Foundation. It will drop on the first Friday of May 6th.
We really hope that you're enjoying the new season and format so far. So please subscribe to us on Apple Podcasts or wherever you're listening. And if you have any questions for us or our guests next month, visit us at umaryland.edu/pulse and drop us a line.
So thanks again to the Patients Program, and thank you for listening to the UMB Pulse.
The UMB Pulse with Charles Shalee, Dana Rampolla, and Jenna Frick is a UMB Office of Communications and Public Affairs production. Edited by Charles Shalee, sound engineering by Jenna Frick, marketing by Dana Rampolla. Music by No Vibe, recorded in the University of Maryland, Baltimore Community Engagement Center.